State appears to have a double challenge with the Ebola disease situation: sensitization of its citizens and monitoring of its long international border. At a press conference, the State Commissioner for Health intimates the public of an illegal border crossing by some citizens of a neighboring West African country.
Our rapid response teams at the LGA level are in place, as are our surveillance teams. In fact, we have already stopped some travelers detained at an illegal border crossing at Imekwafo, who were coming from Guinea. They are being monitored.
In a separate incident, the management of the Federal Medical Center organizes a sensitization workshop for nurses and other health workers on the care of Ebola patients.
Any suspected case must be isolated, must be reported to the authority so that they can be quarantined so that they don't spread the disease to the other people.
This large number of traditional leaders from Anambra State have converged on the Governor's Lodge for a meeting to enlighten them on the Ebola virus disease. At the end of the meeting, the Governor seems satisfied with the outcome.
Personal hygiene, precautionary things to do, like washing your hands regularly, using sanitizers, not shaking hands, among other things that we told them. It's a very erudite, it's a very successful outing.
In spite of the apparent danger, it appears that tourists have started arriving for the Osun-Osogbo festival. This tourist says she has taken the necessary precautions.
However, given the circumstance of the Ebola virus, I actually planned well ahead of time, made very special arrangements and travel arrangements as to when to arrive in the airport, taking special hygienic and sanitary precautions, as well as staying abreast of the news and the recommendations of both the United States and the Nigerian government.
Also in Osun State, the Special Advisor on Health to the state government, in an address to a large crowd gathered at the Ministry of Environment, identifies 4 hospitals that have been set aside as isolation centers for any case of the Ebola disease.
In case there is a case of any Ebola in Osun, we have identified some 4 hospitals here in Osun, 2 in Osun Central, 1 in the west and the east. We have 1 in the Rabiji, 1 here in Osogbo. There is another one in Ejibo, another one in Rojo, Ilesha.
The Special Advisor also urged indigents not to ignore the Ebola scourge, but to be on the alert for signs and symptoms during this year's Osun-Osogbo festival. The theme running through these states' activities seems to be sensitization and precaution, elements which health experts say are necessary for the prevention and containment of the Ebola virus disease. Mary Alale Yusuf, Channels Television News.